Hello and welcome to our second edition of Women's Health. And today we're going to be discussing preparing for pregnancy and during pregnancy. So, Janet, I'm going to let you start.
So, really, preparing for pregnancy starts really early, teenage years, if not younger in life. And the reason we want to talk about this is because in our culture of American society, we've decided that it's okay to be overweight. And I'm going to speak to this very specific to young women. It's not your friend if you think you're going to have a future and having young children and carrying babies without problems. So, first of all, we need to be realistic about how to take care of our body, and it starts very young. And I'm not shaming people, I'm just telling you the truth that you need to start when you are young, building your body in a way that's going to be beneficial if you so choose to have children. So, there's no myth in this. If we are overweight, if we are undernourished, if we aren't exercising, sleeping healthy, then odds are it's not going to work out for us like we intended. And in our society today, we don't always embrace in the American culture um, a woman being a family orientated person or even a mother. And I'm just going to say this right now. It's the most privileged honor to become a mother. I'm not saying everybody should, but I'm just saying it is still an honor. It's a privilege. And I embraced it as well as many of my friends. If I talk to my mother and my grandmother, they have no regrets. And it's one of the most beautiful things that we can walk through in our lives. It's a rite of passage. It's something that it's a treasure. It's beautiful. So, why do I talk about it's important to start early? Well, first of all, when we are young and we start our habits, right? We start how we eat, how we exercise, and how we sleep. So, Shawn and I have talked about on our podcast and throughout the years with our patients about how important sleep is. And it is. It's like one of the major things. And why would you say that, Shawn?
Well, sleep trumps it all. So, sleep trumps exercise and it trumps diet. We will die without sleep before we'll die without food. Largely, we can only go without sleep for about 72 hours, and we start going in psychosis. Sleep is when we recover. That's when we get stronger. That's when our food actually helps nourish our bodies. That's when the exercise, the movement that we've done makes our bodies stronger. It's not when we exercise do we get stronger. We actually get weaker when we exercise. Um, it's when we sleep. So sleep is very important. And what is very important with sleep is that we sleep during the night and we work during the day. That is very, very important. And when you when we raise our families and raise our children, it's very important to teach them that. I get it when they're small babies, it's a little bit different, but you still should get them on a good sleep habit, even though they're waking up nightly to, in the middle of the night to get fed or whatever. I want to touch on what Janet said about being a mother. So, Janet is one of the smartest pharmacists that I know, but I guarantee you that the most important thing to her that identifies her is that she is an awesome mother and an awesome wife. And that to me is very, very important. Because I realize how important her kids are to her and to me, obviously too. But so don't let the world believe that being a mother is not important. And yes, you can be a professional just like Janet is, and still be a mother and make it a priority in your life. So, Janet.
Okay. So, in our culture today, young women are bombarded with all this technology, cell phones, computers. We live this go, 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 go life. And really, to be a good mother and to become a good mother, sleep habits are important. So, get rid of your cell phone by a certain time, make some habits now. Make some time where you are consistent about going to bed and getting the right amount of rest because I can't tell you how important that is. If this is something you want to embrace and be a part of your life, rest and recovery is important. So start now. Um, Other things like Shawn and I have talked about is exercise and a good diet. So I believe a diet of nutritious food prior to becoming pregnant is utmost important. And the reason I say that is we've been taught this for years in pharmacy and healthcare about birth defects and preventing them. But I also believe that it isn't just about birth defects. It's about whether or not we will have good healthy eggs released, or whether or not we have a good healthy menstrual cycle, or a cycle that allows us to become pregnant. So when we do have an ovulation and a baby is able to be impregnated in us, that it is a healthy environment. So it starts prior to becoming pregnant. It's not just about getting pregnant. I believe it starts years in advance.
And you can't get pregnant if you don't have a healthy body already.
True.
The nature is just going to tell you that, okay, wait a minute, is this person healthy enough to carry another person? You have to have a healthy body already. And if you aren't cycling regularly, or you have PCOS, I think we talked about that in the last episode, or you have any kind of metabolic health issues,
Right.
like obesity, it is going to be more difficult to get pregnant and carry a pregnancy. Many times, spontaneous miscarriages are caused by not being healthy. You're lacking something. And so it's so important before you get pregnant to do that. One of the things that's also important in that diet is folate. We talk about folic acid. We talk about, folic acid is one of the things that can prevent lack of folic acid, can cause neural tube defects, which can cause birth defects. So it's important to get enough folate. It doesn't hurt to take a supplement with folate in it. We recommend L-methylfolate because it is 50% of the population can't methylate. They have THFR deficiency. So take an L-methylfolate, a multivitamin or a B vitamin with L-methylfolate in it. Multivitamin is fine if it has L-methylfolate in it. And that's important 6 months before you even get pregnant.
Oh.
So at least
At minimum. And I'm going to jump in here a little bit because we hear in our culture that, oh my gosh, meat's dangerous, like red meat's dangerous. Well, let's talk about this. When we become pregnant, we need all the red blood cells and we need all this iron in us to be able to carry a baby healthy. So, one of the misconceptions in our society is that meat is bad for us or protein is bad for us. And it is actually one of the most natural things that we could do for our body to prepare us to become pregnant, as well as maintain a healthy pregnancy. So many times when we become pregnant, we give women prenatal vitamins that are loaded with iron. Well, why are we doing that? Because our body is being changed in so many different ways, and we take on so much fluid in our body to maintain a pregnancy that it becomes diluted. So we need that extra iron to help the fetus and to help us as a human walking around and feel healthy. So please don't buy into this garbage that we've been telling people. And I'm just going to say it right now. It's garbage. Whatever social media and whatever propaganda is out there today to say that protein's not important, it is. And most women today and most of our young women do not consume enough protein.
And and let's remember that it's not protein from junk food.
Nope.
And Jen and I talk about, protein bars and protein shakes. We consider that junk food. Eat your protein from real food. Eat red meat, eat chicken, eat pork,
Fish,
eat fish.
there's not as much iron in fish. I get
No,
it, but still,
right. But
omegas are good.
And fat. Eat fat.
Correct.
Eat eggs. Fat is good.
Butter,
butter. Those
dairy.
things are really good. Those are what you're going to thrive on when you're pregnant, and the baby is going to thrive on when you're pregnant. We interviewed a doctor, an OB doctor, a few years ago out of New York, and he recommends for infertility many times. He recommends that his patients start eating butter because they tend to get pregnant faster when they eat more fat, because those are healthy fats. Those are healthy fats, and your body says, okay, I have enough nourishment now that I can carry another person.
Right. And that's something that we forget about. I mean, Shawn and I went to school at the time where we were focusing on lowering cholesterol. And let's be really clear about this. We need cholesterol for our brains, we need it for every cell in our body. A fetus needs cholesterol. So let's be very clear on this. If somebody is telling you that that's not important, basically what they're saying that is their brain is not important in development or any of our tissues in our body. So yes, there is a problem with imbalance, but it really comes down to insulin resistance and inflammatory problems, and that in leads to the issue of women becoming pregnant. Usually it's because they have PCOS or polycystic ovary syndrome, where their body's inflamed and their body does not know how to deal with the insulin that they're releasing to take the glucose into the cells. So that comes all the way back to what we've been talking about: sleep, exercise, and proper diet. We can't stress that enough. If you think that, you know, there's some magic bullet out there, which I think America's always trying to look for. We're always trying to look for that in this world. It comes down to the basics. Just start with the basics, build it very simply. Treat yourself well with the things that you need to have in your life that are going to build your body: strong muscles, strong brain, strong
Bones.
bones, and just stamina. Because really, you know, I think a lot of times when we're young, we don't realize that it takes a lot of stamina to raise children because you're up around the clock. It's not a bad thing, it's just part of it. It's, you
And it's
know,
temporary.
it's temporary, and it's something that, you know, as a mother, you think, oh, when is this going to end sometimes? But it does.
And then when it
Really,
ends, you miss it.
you kind of
So
miss it.
embrace it
Right.
when it's there.
But here's another tip. So when you go in and you're a young woman and you go in for your um maybe your exams, and a physician or a nurse practitioner or a PA says to you, "What are you doing for birth control?" Let's remember the lie that we've been taught. Birth control pills are actually putting us in a temporary menopause. And that is a huge issue for young women who want to have a family.
Or want to have good health later on.
Right, exactly. Exactly. And why is menopause an issue? Well, first of all, you want to have healthy bones, you want to have a healthy brain,
Healthy heart.
a healthy heart. I mean, it affects all of our organs. And you know, we thought that this thing about birth control would be a blessing or something that was very liberating. I'm not saying it isn't, but it actually has turned into kind of a nightmare, because many women, as they progressed and decided in their 30s, after going through school and doing whatever they thought they were going to do with their career, and then they stopped their birth control pills, found out that, oh my gosh, it's hard to get pregnant, or I have fibroids, or, you know, I have polycystic ovary disease, so I'm really not releasing an egg at the appropriate time to become pregnant.
Or birth control pills cause breast cancer too. Those are
Or
facts
uterine
also.
cancer.
And uterine cancer. So another reason to stay away from them, especially if you want to have a healthy family and a healthy body yourself later on.
Right.
And let's just talk about, Jenna talked about insulin resistance and how important it is to follow a diet. And I just want to say this. Obesity is not something to be celebrated. And we have a huge problem in this country with obesity. It is epidemic. It is killing more Americans than anything, period. And it's very sad when Janet and I see a wedding party, when we go out and we see a wedding party, and we see that 9 of the 10 women that are bridesmaids and or the bride are obese, and they're in their 20s. That's very sad. It's not something to be embraced. It's not something to be celebrated. It's time to face the facts and speak the truth. Obesity kills. And we aren't saying this to shame anybody. We say this because we love people. And
Right.
we love obese people just like we love everybody. And we want to make sure that they know how dangerous it is to be obese. And many doctors don't tell people the truth.
No.
And the answer is not Ozempic, okay? The answer is definitely not a drug. You don't have a drug deficiency. You have a dietary problem largely, and you can't exercise your way out of a bad diet. So don't say it's because you can't exercise. It's an eating problem. You're eating the wrong food and too much of it.
So here's one of the falsehoods that has went through our culture in the last maybe 3 years, 2 years. When I was taught in pharmacy school, if you became pregnant, you did not take any medication unless it was proven, like proven and used over and over. So when
And even at that, don't take it unless you absolutely have to.
minimal. So where I'm going with this is that it shouldn't I shouldn't have to say this, but obviously recreational drugs is a huge issue. And right now in our culture, we think marijuana is just fine because it's
Legal.
classified as legal. So if you are someone who's participating in this type of recreational use, stop if you want to have children.
If you have healthy children,
Stop drinking alcohol if you want to have children.
alcohol is poison.
Because it sets your body up for problems down the road. And I'm not somebody that's trying to be a prude. I'm not trying to preach to you. I'm just saying, if this is important to you, recognize the fact that these substances are not your friend if this is what your future desire is, right? So don't do that. And the other thing, even when I became pregnant, I eliminated caffeine. I eliminated, I think at the time prior to becoming pregnant, I loved to drink diet sodas. I did not drink that when I was pregnant. So I avoided anything that could be a foreign substance. So I drank water and I ate real foods. That means if it doesn't rot, you do not eat it. Period. And I think that's huge because it makes a big deal. And also, when we're talking about nutrition, let's realize that water as a fluid is super important to our health. And Shawn and I, we reflect on this about when I was pregnant. I would drink daily a lot of fluids because my midwife at the time said many times women gain weight during pregnancy, and that's natural. We should, but we don't want to gain extra fat from extra eating. And she said many times it's because we have the desire to drink, or we think it's hunger, but it's really we're thirsty. So starting the habit of drinking water and fluids on a natural day-to-day prior to, I think, is really important too. And when you become pregnant, stay very hydrated. Don't get dehydrated because that's when we start having issues.
And I think you gain 50% of water mass when you're pregnant. So there's a lot of you need a lot of fluid for sure.
Well, the distribution.
Yeah, this is the volume of distribution in your body now. And let's speak. Janet didn't mention nicotine.
That's another one.
Right.
Yes.
And usually nicotine is associated with tobacco. Okay. And I think most people understand that tobacco is dangerous, causes lung cancer and many other cancers, throat cancers, mouth cancers, and all that kind of stuff. But you know what? Vaping isn't any better.
No.
I don't care what kind of studies are out there, negative, positive. You are putting an addictive chemical into your body. Nicotine is poison. It will kill. It can kill you at a certain dose. It is a stimulant. It can cause heart attacks. It can cause heart racing. It can cause a heart attack, vasoconstriction, decreased peripheral vascular circulation. Not good for a pregnant mama. So stay away from nicotine. And this should go without saying, but not just while you're pregnant. Just stay away from it. It's a horrible drug. It's amazing that it's legal. It's kind of interesting in this country that in some states raw milk and raw raw dairy and eggs or farm raised eggs that aren't approved by the FDA are illegal. Yet, nicotine to products and alcohol are legal. I mean,
Marijuana.
and marijuana is legal.
Right.
Boy, that makes a lot of sense, doesn't it?
Right. So if you're one of these ladies that finds that they're having difficulty maintaining a pregnancy, which Shawn and I do see in our practice quite often, a lot of times it's not because you um, are 100% bad in your diet, because about 30% of women that have PCOS are thin. Sometimes it's also a lack of a hormone called progesterone. Sometimes it is with activity or lifestyle, but sometimes it's not. So we've seen many women throughout the years who have gotten pregnant but can't maintain the pregnancy. And so we want to speak to you about this one, because in the medical system, we send you to fertility people and you spend thousands and thousands of dollars. And usually the problem comes right back to a hormone called progesterone.
Progesterone means in Latin, pro, support, for, gesterone, gestation. Actually, in the luteal phase, the last half of the cycle, you can't get pregnant without progesterone, without enough of it. And you can't maintain a pregnancy without progesterone. And one of the mistakes we'll see if you do start progesterone, somebody starts you on progesterone, usually it's a person that knows hormones very well. So they'll start you on progesterone, and then they'll do the good deed of referring you to the OB doctor at 8 weeks. And then the OB doctor will say, well, you need to stop progesterone because you don't want to be on hormones when you're pregnant. And then they stop the progesterone and there's a spontaneous miscarriage. So progesterone, you cannot overdose on during pregnancy. In fact, in the third trimester, your levels are 1,000 times higher than they are before you're pregnant. So to think you can overdose on it and it's bad for the fetus is just ignorance, pure ignorance.
It is. And let's be really clear. You can just crack biology book 101 in your college courses, and it might be even in the high school courses now, where when you become pregnant in that first trimester, your corpus luteum should be producing enough progesterone to maintain the pregnancy throughout the whole time that you are pregnant. If that's not happening, it's because your body does not produce enough of it. So these fancy stuff and all these dollars that people put in to maintain pregnancies and to become pregnant, a lot of times just starts with the imbalance. And that could start with, first of all, you didn't have regular cycles, they were heavy, or you just missed many cycles, or, there's just some imbalances there. So if you're somebody that has not had regular cycles throughout your life and you are choosing to embrace being a mother and become pregnancy, make sure you have good progesterone levels and make sure that they are maintained for the first 2 trimesters.
And remember where progesterone comes from. Progesterone has a cholesterol backbone. It is made from cholesterol. All sex hormones are made from cholesterol: testosterone, estradiol, progesterone. They're all made from cholesterol. So we have vilified cholesterol in our society today, and mostly because a drug company wanted to associate cholesterol with heart attacks because they knew they could lower it with a drug called statins. And so we vilify cholesterol, saying that's the problem causing heart attacks. And then they can make billions and billions of dollars a year on selling a drug, which statins are one of the classes of drugs that I would never, ever take or never, ever recommend. The high cholesterol causing heart attacks and cardiovascular disease is total bunk. If it worked, then how come after being out for 35 plus years, how come cardiovascular disease is at an all-time high in America? Let's also use the example of this. You guys have probably heard that eggs are high in cholesterol, right? So why are eggs high in cholesterol? Think about what an egg is meant to do. So we're talking about chicken eggs, basically. What is that egg meant to do? That egg is meant, the yolk and the protein in the egg, and there's a lot of cholesterol in it. It is meant to nourish a little chicken for days. So think about how nutrient dense eggs are, and think about how important cholesterol is, especially for a little baby's brain.
It's so
Don't
true.
buy the cholesterol myth. Cholesterol is not bad for us. Every cell in our body has cholesterol. We would die without cholesterol. And I do believe there's a lot of problems, including hormone problems, caused because we are lowering people's cholesterol. I also believe that we're causing a lot of brain issues like dementia and Alzheimer's because we're lowering people's cholesterol with statin drugs.
Totally true. Another myth that would be that I think we follow in pregnancy is exercise is not important. I don't buy that for a minute. If I think about how many children my grandmother raised on a farm, no,
Did she stop moving when she was pregnant?
not once. I mean, when I look back at my mother's generation and my grandmother's generation, those women were in motion and moving. Grandmother got up at 4:30 in the morning, 5 o'clock in the morning to start the day. They were always moving. I'm not saying that rest is important. That's not what we're saying. But movement is super important to maintaining health. So if you're pregnant, unless there's an extreme problem in that pregnancy, movement's important to the overall health of you. So stay moving. And, I'm not saying that to be comfortable, but, you still need to move throughout the pregnancy because believe me, after you have a baby, movement's still going to be huge and important. The other thing that I want to talk about a little bit, and Shawn, you can help me with this, is postpartum depression.
So let me just say some other things during pregnancy. So, like Janet talks about exercise being important during pregnancy or just movement in general. Um, many pregnancy related diseases,
Mhm.
preeclampsia, pregnancy induced hypertension, um, those are largely symptoms, diabetes. Those are largely, yeah, gestational diabetes. So just realize if if you have gestational diabetes, your baby has a huge disadvantage that they might have diabetes too later on. So just realize that. And of course, it's setting yourself up for health failures later too. But realize that most of those pregnancy induced diseases are largely manifesting because you're already metabolically unhealthy. And then all of a sudden you have another human inside of you and your body gets overwhelmed, says, I can't do this anymore. And that's why your diabetes comes out. You already had diabetes because you were already eating bad. That's usually the case. And this just exacerbated the situation and it exposed it. So if you take care of your body, you won't have things like that. Think about how our body was designed. Our body was designed to stay healthy during pregnancy. And yes, when you're older, having kids older, then there is going to be more issues. That is true. But largely, if your body's healthy, then you're going to have a healthy pregnancy, a healthy baby. And what were you going to say, Janet?
We were going to talk about postpartum depression.
Okay. Another thing is, in order to get pregnant too, we talked about progesterone. Your thyroid has to be optimal.
True.
Many times there are people that can't get pregnant because their thyroid is not optimal. They have miscarriages because they can't maintain a pregnancy. They have miscarriages because their thyroid isn't optimal. So postpartum depression. So guess what? When you're pregnant and all of a sudden you have a baby, your hormone levels, especially progesterone, goes
and sometimes way too fast.
Goes down really fast. Now, if you're breastfeeding, which every woman should breastfeed, then your progesterone levels will stay up a little bit higher because you do have progesterone. Because you produce more progesterone when you're lactating. So you don't lack Prozac, you don't lack Zoloft, you don't lack Effexor, you don't lack these antidepressant medications, okay? That's another class of medications I would never, ever, ever take. At least not long term. Maybe short term, but I would not do it after pregnancy because that's not what's going on. So go ahead, Jen.
So usually what's happening is these hormones are dropping way too fast and not at the level that's healthy for you to maintain how you are feeling mentally and psychologically. So we have found throughout the years that there are physicians that have actually dealt with women in a natural way. And usually what they do is they give them injections of progesterone and then they give them progesterone to take throughout the day and taper their hormones down in a natural way. And I believe that that is a much better approach because progesterone is natural to our body. It also is not going to be harmful if you are breastfeeding.
Mhm.
And you're not going to have this crazy, like, no libido after having a
Mm-mm.
baby, or suicidal tendencies because you're on an antidepressant. In fact, it's a calming hormone. It's naturally meant to calm our other, to calm us because it balances our other hormones. So it's a natural approach. And I think it's so overlooked in our society. When somebody comes through the door with uh, a primary physician today, or even your OB, if you are depressed after having a baby, the first thing they're going to do is put you on an SSRI,
Don't
which
do
is
it.
like Prozac, Zoloft, Wellbutrin. And to get you off of those medications is going to be extremely hard. And the other side effect is that it also puts you in a bad situation, because many times that affects your libido, it affects your mental feeling about, being around other people, as far as being um, tuned into things. It's just kind of, people sometimes just
Just
zone
check out.
out. Yeah. And so I'm not going to be judgmental if that's the course that you have chose. But here's the thing, there's a much natural and easier approach that can be done very easily after. So if like, maybe this is your second child and you've already went through this, make sure that your progesterone levels are healthy, and also your thyroid. That's like Shawn touched on, because thyroid can really, especially in women that have Hashimoto's or some thyroid resistance, if their thyroid gland is not producing thyroid after pregnancy, that can be an issue too. So those are just some tips to help you along the way if you want to handle things naturally the way our body was designed.
And realize that those SSRIs, Prozac, Zoloft, Celexa, those things, realize that those cross into your breast milk.
Right.
So realize if you're breastfeeding your baby, those drugs will get into their body. And
Which,
they're not good at all. And by the way, you don't need sleep medication either. Don't take sleep medication. That can get in your breast milk too. If you follow the standard, just think about how our bodies were meant to take care of a baby. Do those things. When you breastfeed, you produce all kinds of neurotransmitters that are going to help with depression. It's going to help you sleep. It's going to help so many things. Do the right thing a mother does with their bodies, like we did generations and generations ago, and it will be much easier. And think about this: the best antidepressant ever invented is exercise.
that's true.
And there is no reason you shouldn't be exercising. And by the way, do not give me an excuse that, well, I have a newborn baby, I don't have time to exercise. You know what? The newborn baby sleeps a lot, for one. And by the way, when they're sleeping in their crib or wherever they're sleeping, you can be exercising. Do 10 minutes of exercising. And you know what? Your baby is going to see that. Your baby is going to see you moving. Your baby's going to see you doing push-ups, doing body weight squats, walking,
Start with
running
walking.
running in place, doing burpees, jump squats, whatever it is. Simple stuff. You don't even need any weights. And your baby is watching you. And as you progress and as your baby gets older, let them start exercising with you. Just moving around on the floor to begin with when they can crawl around. It's really that simple. Get them started that young. I have seen women do that, and it is a wonderful sight. And by the time the baby can walk, I mean they're exercising with mom.
Right.
Think about what we do in the wild. In a wildebeest, a wildebeest has to be able to run within 20 minutes after being born. I get it. We're humans. We're a little bit different. That doesn't mean we shouldn't be moving all the time.
I agree, because there's something about, and the other thing too, when Shawn and I reflect back about our children, is we took our kids outside. Like, we were walking our children early in the morning before we went to
I
work
remember those
in a
days.
stroller, and exercise and being outside. And there's nothing probably more proven, I think, in this world, with any parent wearing your child out, even in the stroller, or just getting them outside. I mean, think of how much more you can get them to sleep when they've been exposed to the outdoors, or just running around the yard. So it doesn't have to be huge, but it's little things and little tips. So I'm super happy that you tuned in and listened to us. And I hope some pearls have been transferred to you and that you can glean from them. And why we do this is not to shame people. It's just to tell them some truth, because I think that's lacking in our society today.
Our goal, as always, at Health Solutions is to educate and empower individuals to take charge of their own health. And I hope you learned something from this today. Stay tuned for our next episode, which will actually be episode 3 on women's health as we progress when a woman gets into premenopause, perimenopause. We'll go into that later. So thank you for tuning into Health Solutions on our women's health episode. Thank you.